With that, I'm going to open it up with Scott.
Governor, the Mississippi State Medical Association came out today saying that we should issue a statewide mask mandate. You've done 13 counties so far. Why not do a statewide mandate for masks?
Well, what I would tell you is that those individuals at the State Medical Association and I have the same goal, and the same goal is that we increase the number of people in our state that are wearing masks. We may not 100% agree on the best way to accomplish that. I know that every dentist I know wants 100% compliance for every kid to brush their teeth every single night. Some kids, if you tell them you have to brush your teeth, they just won't do it. It's just the reality of where we find ourselves. My view is, much like we have done in the past, much like we did in Leake County and in Attala County and Neshoba County and in Newton County and in Jasper County, if we issue orders that are specific based upon guidelines that we tell people about. For instance, the 13 counties that we have currently include those counties that have at least 200 cases over the last 14 days and or reach the threshold of having 500 cases per 100,000 residents. And so those are the ones that are most, we believe that are most important. And we believe shining a light on those counties will help get compliance in those counties. The reality is that if we just issue a statewide mandate, there are going to be people in our state who say, well, I'm in Tishomingo County, and he just did that because things are really bad in Hinds County, and so I'm not going to necessarily adhere to it. Our goal has to be, how do we get the best, highest number of individuals adhering to wearing a mask when they're in public and ensuring that they maintain social distancing guidelines. And we think that the approach that we're currently taking is the best way to do that. I appreciate the opinion of our state's medical community. They are on the front lines and they are working hard. But I also will tell you that all of us have a role to play here. I need those in the medical community and those in our hospitals to adhere to our executive orders, which require 25% of capacity in hospitals to be for COVID patients. I need individual Mississippians and other parts of our state to wear a mask when they're in public. We need to understand that we are all in this together. We need to understand, as I said yesterday on social media, that we are not enemies with each other. Our enemy here is the virus, and we have to do everything we can to try to keep the virus from being spread, because if we don't, our healthcare community could become even more at risk.